Wahoo, pilgrims.
First aid kit, roll 5, scene 1, take 2. Action. Wahoo, pilgrims. Fat Elmo back here again. We're going to do another installment over first aid kits. This time, much more comprehensive first aid kit than the little emergency one that we had. This is what I usually bring on group trips, or if I'm leading a trip, I'll bring this more comprehensive one. As you can see, I have everything in a Pelican case, which is completely watertight and crush proof and pretty much indestructible. I have a locking carabiner on the handle, so I can just tie this into the belt without it getting away if something does happen. Inside, there's a whole bunch of first aid stuff. Now you can have all this equipment, but if you don't know how to use it, it doesn't do you much good. So it's always good to take a first aid course, advanced first aid course, or a wilderness first aid course, just to make sure that you know what you're doing with all this equipment in case of a medical emergency. Well, the first thing I have here, usually up on top, is my micro shield, which is a mouth barrier in case you have to perform CPR on anyone. This way you don't get their puke and what other bodily fluids that they're belching up into your mouth while you're doing CPR. Inside, they supply a little alcohol wipe and a pair of latex gloves. I usually have that on top of my first aid kit. Then, as we proceed to take things out, make some room here, I have this wound seal powder, which is supposed to stop the bleeding instantaneously. I have never tried it yet, but it's supposed to work. So then I have a little box of Band-Aid butterfly closures. A little pill bottle, usually with uncoated aspirin, which may save somebody's life if they are getting a heart attack. Just chew one aspirin and doesn't hurt. Might save somebody's life. Now you may wonder why I have a Betty Crocker decorating white gel tube of icing in my first aid kit. Well, folks, if someone goes hypoglycemic, then a shot of this in the mouth will get their blood sugar way up fast. So if diabetes, or someone on the trip has diabetes, and they do have problems with their sugar level, like I said, a shot of this stuff works great. Then I have conforming band-aids, or bandages I should say. Then of course, the ever-present emergency space blanket, which will keep your patient warm and dry, more so than if you didn't have it. That's always a good thing to carry in any emergency kit. I have plenty of surgical dressings. Also have a pair of latex gloves, which you always want to wear if the person is leaking somewhere out of their person. Some more gauze, roll band-aids, bandages, more of those. Believe it or not, if you have a dental problem, let's say a toothache, this is probably something like oil of clove But this is a little toothache kit, so you can just alleviate some of the pain of a toothache until you get yourself to a dentist, unless you perform an extraction with a Z-Drag, which we'll get to a little bit in the future. Then I have my vacuum sealed bandage packet. A whole bunch of band-aids in here, gauze pads, surgical dressings, the whole works, and it's all sealed tight in a food saver bag. Then I have a burn kit. Basically, it's second skin, some rolled up gauze, aloe gel, ibuprofen for the pain, antibacterial ointment, and this is my wound management kit, which basically is iodine solution, tweezers, band-aids, gauze, an irrigation syringe, not for injecting drugs or anything, but for just cleaning out wounds before you put the patch on, some tape. These things can all be bought separately. I managed to get these things dirt cheap, that's why I have them, but you can make your own. Some more old gauze. I got enough gauze in here to pretty much go around the planet. Some second skin, which actually works very well for burns too. Another face shield for CPR. An ace bandage for sprains or anything that really requires the immobilization to a certain extent. Then I have some Cordaid, which is a hydrocortisone anti-itch cream. If you get a sting bite or something, I carry a little flashlight with me. These are always good to have. See what you're doing in the dark. Some more gauze pads. More gauze pads. This is a very handy item to have, an EMT scissor or a bandage scissor. These are useful for cutting bandages, of course, and also bits and pieces of clothing that you may have to cut off the victim. A lot of people, a lot of whitewater people, carry these things instead of knives on their PFDs because you can also cut through rope quite easily with these things. They're very sharp, very good to have, not very expensive at all. Next comes a pair of tick tweezers. Very fine tweezers to pick ticks off you if you do happen to find them on you, so you don't want to come down with any Lyme's disease or Rocky Mountain spotted fever. Some Benadryl cream, which is basically probably the same stuff as this. It's an anti-itch cream, antihistamine. I have a digital thermometer. Check for fever. A whole bunch of band-aids. I got band-aids all over the place too. Wooden tongue depressors. I don't know why I have 3, but I throw them in anyway. And then more band-aids. Then I have these packets of Neosporin, which is good to help fight infection and some minor scrapes and cuts and burns. These individual little packets, they're hard to find. I haven't seen these in years. Then a very useful item to have is a SAM splint. This basically is a splint that you can use for immobilizing a limb in case of a fracture or a bad sprain. It conforms around the limb, as you can see on the directions in the back there, and these things are relatively light and very, very useful. Moderately expensive, but I forget what they were, but not too bad. And basically, I also have a roll of tape, bandage tape, a packet of Tylenol. May want to change this every once in a while. You know, this goes bad after a while too. And a little packet of surgical razors. All in this. Oh, can't forget this. Got some Orajel base in case you have any sort of mouth irritation. You can slap that on there and alleviate the discomfort a little bit. And that's basically about it. It all fits in this little Pelican 1300 case. Now from our other corporate sponsor, Spam. If you eat this stuff, all this is not necessary. And our other corporate sponsor, 20 Mule Team Borax, the detergent booster. It'll clean anything. Even Ronald Reagan said that.
Or was it Paris Hilton?
So until next time, this is Fat Elmo wishing you well